we did a thing together called semaglutide, also known as Wegovy, game changer. And it is a game changer, but you mentioned the catches. The catches are the ridiculous prices, the lack of insurance coverage, and probably the fact that you have to stay on it for life or a long term. But can you repeat to the audience, and what you said in one of your slides is so important, because this comes in several forms that people see on TV. They see it as Rybelsus, they see it as Ozempic, but these are different dosages. But now the FDA approval of the weight loss injection is Wegovy. And so this is the drug that everyone thinks is a game changer. And there's another one hanging out in its class called tirzepatide or tirzepatide, Tirzepatide. Okay, that's the way. I always know spellings. I don't always know pronunciations. Can you basically tell the audience again why you think, unlike the past, these are true game-changing meds that should be in discussion for people that need the help with their doctors?
Yeah, I think for years, what's been used by doctors for weight loss, and this goes back to the 60s, are the stimulant medications. So things that we now use maybe exclusively for ADD or attention deficit disorders with the stimulant meds have long been used, quote, as diet pills. The trouble with all those medications as a class and as individually is that they all elevate blood pressure and heart rate.
Exactly.
And when you elevate blood pressure, regardless of how much you elevate blood pressure, and regardless of how much the FDA might ascertain an elevation in blood pressure is safe, there is no true safe elevation in blood pressure. Every blood pressure mean elevation is associated with a greater risk of mortality or event. Any medicine, and the FDA is very aware of this, and it's the newer class of testosterone medicines that have been approved have gone through ambulatory blood pressure monitoring, where people have to wear a blood pressure monitor while using the medication in its phase 3 trials prior to approval to see what blood pressure elevation occurs. We know that testosterone, because it's a steroid, can elevate blood pressure. And so it has to be monitored closely by the provider or clinician who prescribes testosterone. All of those meds that were given as diet meds in the 60s and 70s all elevated blood pressure.
Yeah.
So indirectly, they were increasing the risk of heart attack and stroke. Yeah. So these new meds actually lower blood pressure. They lower blood sugar. They increase insulin levels, but they don't cause insulin resistance. They lower, after a period of time, that belly fat. That's inflammatory fat. It's not normal fat. It's great if you're a bear and you're hibernating, but as human beings, we're not doing either. So we need to get rid of this belly fat that we see as we age, and these meds reduce that. They reduce cravings, they reduce hunger, and you eat less and you feel full, and you're at overall reduced risk of death by using these meds. So if you're going to need a med, not all meds are created equal. There are meds that have good effects and bad effects. We might need a low-dose anti-anxiety medicine like an SSRI, like Prozac or sertraline. For life, we might need a medicine to help with heartburn. We have to look at these meds safely and see if they're effective and if they're safe for long-term use, because many of us dealing with the stress of today's world are using these medicines to manage these constant, continuous lifestyle stressors.
Yeah.
and disease states that come with civilization. And if we're going to need a medicine to maintain our weights, because we saw that a reduction of at least 10% in weight reduces mortality significantly, it should be a safe medicine.
Yeah.
And that's the game changer of these meds. The trouble is right now, there are no generics, and their expense is ridiculous. People are willing to pay for them, and Novartis, the maker of Wegovy, can't even make it fast enough to keep it stocked.
That's just unbelievable. But there's other ones coming along in the class. Like I said, I'm trying to learn. This is all new vernacular for us. So the semaglutide's your game changer. Tirzepatide is maybe with a future game changer that's working as well. But what you said, what people don't know is thousands and thousands of doctors watched an exchange that we had in the past. And you said this, and I didn't think about it, that the weight loss has been so significant from these drugs that they're starting to press upon, in some cases, bariatric surgery results or weight loss surgery.
Right.
Can you talk about that again briefly?
Well, this is the only drug. When I was going through in the talk, you saw those changes in obesity, and these placebo-controlled trials after 1 year were less than 6%. With bariatric surgery, you can achieve between 15 and 18% weight loss of body mass over a year to a year and a half. With these medications, you can now achieve that same weight loss as bariatric surgery with a medication and maintain it.
Thanks so much for watching. If you would like more information about prostate cancer and all sorts of education, you can visit our website, PCRI.org, and subscribe to our YouTube channel. We come out with new prostate cancer education videos every week.